In Nevada County, the Behavioral Health Department has put together a whole system of care, a series of programs, family resource centers, and partnerships with schools, nonprofits, and other departments in the county to help identify kids with behavioral health issues and direct them to the services they need. It's a holistic approach to serving these kids, teens, and their families that's working in Nevada County.
I think it started several years ago. A group of us got together to reinvigorate a children's system of care in the county. That was a partnership with the superintendent of schools, with special education, with probation, child welfare, the courts, and children's behavioral health. As Mental Health Services Act funding flowed into the county, we were able to add more than just treatment. So initially our focus was on treating more children and families and having therapists associated with all the schools in the county. That was our dream. But as we received prevention money, then we broadened our focus into areas like anti-bullying, suicide prevention, and mental health screening in the schools. So this opened up a whole new area for us, fueled by Mental Health Services Act prevention and early intervention dollars.
We meet on a weekly basis with child welfare, probation, the schools, and public health, and we discuss families that we're worried about. And we also meet on a bi-weekly basis to discuss our highest need families with, again, the same team. The concept is that we all own helping getting families better, and we all work together.
The critical piece of those meetings is establishing relationships and open communication so that mental health isn't operating in a siloed area. We're not effective that way. We're only effective if we have trust and free-flowing communication with other partners in the community that work with troubled children and families.
Our Nevada County Mental Health has been a huge support to our school. We actually had a few suicides in 1 year, and Nevada County Mental Health was here every day. They were here as a support, as counselors for the grief, and they were here to help us get started with the Sources of Strength program. They actually brought it, introduced it, and had me trained as a facilitator. Sources of Strength is a suicide prevention program. It is actually student-led and facilitated by an adult, and it is to change the culture of campuses. What it does is it brings together a group of students from all different cultures on our campus. So it's the athletes, drama department, students that aren't involved in anything. It's high-risk students, a whole conglomeration of kids. And they get together and we talk and say, what can we do to change the culture on our campus where students aren't afraid to share when they're having problems or suicidal ideations. They come up with ideas of what they can do to get that news out to students, find somebody to talk to, and then we identify the strengths that they can draw on through those hard days.
My freshman year was the first year that Source of Strength came about on campus, and so Chris Espedal asked the teachers what students they felt were leaders on campus. We were invited and went through a whole day of training.
And they're not counselors. We're not asking them to be the counselors. We're asking them to gain that trust of their peers, where then they can take it to somebody who's qualified to deal with them and help those students.
I really enjoy helping people. I like talking to people and hearing about their issues and everything and trying to help them through those problems. I've seen a lot of people more open to talking to staff members on campus. We've done things such as asking kids if they had an issue, what staff member they'd go talk to, and we put a big bulletin board of all the people's comments on Post-it notes. And people really looked at that and saw different staff members that they could talk to and that people trust. If there's someone sitting by themselves at lunch, I try to go and talk to them. If we see someone like that or we hear that someone's having a problem, we try to bring them into Source of Strength, show them that there's a group of people that do care, that there's staff members. We show them all the resources that they have. And we have Mix It Up days that you're supposed to go talk to people that you're not friends with. And so it reaches out to those kids.
One of the projects that our group did is paint the pillars here in front of our cafeteria. And they painted each pillar with a source of strength. So spirituality, mental health access, medical health access, healthy activities. There's 8 strengths that we help to identify. Even as they're standing in line, they can check out those pillars and say, oh, there is somebody around. For me, it's just a great privilege to be able to work with high school students that have a heart for doing something like this.
For us, we like to think of the Family Resource Center as a first stop for any family in Nevada County. When we started these under this grant, we wanted to be on a school campus. We felt that connection for families to be able to walk across, maybe after they drop their child off, or come over after school, would make it easier for them. And then we have great connections with the school, the services, and also the site. The site is offered in kind, which we could not have done without the schools. We have a variety of resources and referrals. Some things we do here, and some things we send people out to. So it's that first connection if they're in need of anything. We have parenting classes where we get people who are physicists and people who've been asked to come to parenting by the court. So we have a wide variety. The Safe Schools Healthy Students grant we got had to be that non-siloed connection. So our core management team that helped develop it has people from probation, has people from the county, it has people from behavioral health and education. Our piece is to connect families with whatever they need so they don't fall through the cracks. We have immense services here. We are so lucky in a small county to have as many services, but often they're hard to access because people just don't know where to start. So we try and make it easier for them to start the process.
We were fortunate to get the funding and support from Nevada County earlier this year to support the wellness centers. There are new programs that are site-based centers to support students access community resources and get support where they need it. And Sources of Strength comes underneath that. So we've kind of taken one Nevada County program, that Sources of Strength, and a new funded program, Wellness Center, and put them together. And it's a safe space where students can come, hang out. We have couches, bean bags, music, snacks, tea. And it's a space where they can just be themselves and they can talk about what's going on if they have something on their mind. And we have staff and we have volunteers from different agencies that are there to connect with students and find out who they are and what's going on. And then once that relationship and trust is built, if there are other things going on in their life, they can connect them to those resources. And it's really breaking down the stigma of that you're coming in and talking to someone because you have something wrong, but that everybody has stress, everybody has things going on in their life, and it's okay to come in and just talk about what's going on and get that access point in a really comfortable way. We had a hard time outreaching to young people in our community, and so we realized we're just beating our heads thinking they're going to keep coming to us, we need to go to them. Up in the Tawa-Truckee area, we have about 40 plus nonprofits, and it's a great way to connect them to services that are needed or to get them into the county services. And we've had such support and partnership with Nevada County, and they include us in all their meetings, and it's really improving services all around, I think.
Yeah, What's Up Wellness Checkups are emotional health screenings that we offer at area high schools throughout our school district. And they are a screening, a suicide prevention program and an emotional wellness screening.
Basically, it's a prevention program, so it's to help prevent any future issues that could be going on, and also it's really to assess, stress that a lot of kids are going through in school, and to really help provide support if they need it. Doesn't necessarily mean if there's some mental health issue going on, it's just really like a checkup. They're surprisingly open with us.
So out of the 400 or so students that we've screened, we have about 30% that we're connecting with services after for support. So that's a pretty high number. So we're utilizing a lot of those programs, such as behavioral health therapists that they have in the high schools.
And also another area for prevention that we were able to get into was doing better outreach and engagement to our Latino population.
Well, I'm promoting mental health in the community. The school allows to use their facilities for my program. We talk about mental health. We want them to feel free to eliminate the barriers. Our brain is another organ, and we need to talk about it freely. It's hard to talk culturally, but we are breaking down that barrier. Definitely, this I couldn't do it by myself. I feel like I have a big group of people supporting me.
In our county, we just decided we don't need money to meet with each other, and we don't need extra money to leverage the funding that all the different departments have. So when we put together probation funds with child welfare funds, with all the different varieties of mental health funds and special education funds, you start putting all that together and you can multiply it. You got to have some trust too. Somebody's got to break the ice and say, I'm willing to do this. I'm willing to give this.
It's given me a bigger outlook on people. It shaped what I want to do after high school. I want to be a psychology major in college and become a therapist.
I think wherever a kid is, and if we're needed, we're there.
The success comes in students coming in asking for help. That is the success. We have a high-risk counselor that we have access to, and we always have mental health that we can call. We're referring more students now, where before we didn't have that. So I'd say that's how we measure success.
There's no barriers. They really care.
It's been really an exciting journey. It's really added a lot of juice to our work when we bring in all sorts of other people. Personally, I feel like I'm part of a community as I never felt before when things were so siloed.
One barrier you need to take off the table is, well, we don't have money to do it. It doesn't take any money to sit down at a table and talk with people. That's a freebie with a huge payoff. Now it's the normal way we do business, and we really can't imagine doing business any other way.